So herein we again present after a long series of subluxated cataracts. This is a traumatic subluxation, and if you see here, almost 5 clock hours, the zonules cannot be seen. And more importantly, there is a scar of the cornea, and I can see scarring on the anterior capsule. So these lenses are very typical because rhexis is important, but rhexis in a scarred anterior capsule is really very difficult. So I use my micro-rhexis forceps and just see my force. So I am lost here at the wrinkling site. So my Sinski comes for the rescue. The Sinski gives me a leverage, and I again rescue, and the rhexis gets completed. So rhexis is very important in good placements of these subluxated cataracts. So the routine main port incision. Now care has to be taken that every time the OVD has to be in the anterior chamber to prevent that vitreous from prolapsing from the defect. So this goes in a normal capsular tension ring. But look, if you carefully note, this capsular tension ring gives me a resistance, and at this site it fails to enter. So I do not apply a force, but my direction of force changes. So I enter the anterior chamber with 2 Sinski hooks and then gradually pull it towards the center and then snug it underneath the anterior capsule. And once the capsular tension ring is in, I very carefully aspirate the cortical matter. This is a child, 12-year-old, doesn't give me much discomfort while aspiration. You have to be very careful if you have vitreous tags in the anterior chamber. Anti-vitrectomy can always be done for these vitreous tags, and they can be identified by using triamcinolone. This is a 3-piece hydrophobic foldable IOL, which is my choice in these subluxated lenses. If my bag goes shaky, I can anytime glue these 3-piece IOLs, and this 3-piece IOL would then go and sit in the bag. After the surgery, I routinely check for any kind of zonular weakness if I feel, and capsular tension segments can then be added on for additional support in these patients. So the IOL goes and sits in the bag, viscoelastic is washed, and then the wounds are sealed and secured. These are the post-op slit lamp photographs which show day 1, the lens is stable and the patient enjoys a good vision recovery.